This is a NCLEX practice test for reduction of risk potential. The practice test will help you prepare for the NCLEX RN exam. This practice test consists of 40 questions that focus on reducing the risk of potential problems, such as infection and medication errors and more. Let's get started. 1. A nurse is assessing an African American client for risks of a pressure ulcer. Which of the following best describes what the nurse might find with an early pressure ulcer in this client? A. Skin has a purple/bluish color. B. Capillary refill is 1 second. C. Skin appears blanched at the pressure site. D. Tenting appears when checking skin turgor. Correct answer: skin has a purple/bluish color. When assessing for signs of developing pressure ulcers in a client with dark skin, decreased circulation may not always be readily apparent. For instance, blanching, the red undertones seen in light-skinned clients, will not always be present. Instead, the skin of an early pressure ulcer may develop a purple or bluish color. 2. A nurse is preparing to irrigate a client's indwelling catheter through a closed, intermittent system. Which of the following steps must the nurse take as part of this process? A. Use sterile solution from the refrigerator. B. Position the client in the prone position. C. Clamp the catheter at the level above the injection port. D. Inject sterile solution through the injection port into the catheter. Correct answer: D. Inject sterile solution through the injection port into the catheter. When performing a closed intermittent system of catheter irrigation, the nurse should draw up sterile solution that has been at room temperature using sterile technique. The client should be positioned for easy access to the catheter site and to assess the abdomen during the procedure. After clamping the tubing below the level of the injection port and cleansing the site, the nurse injects fluid into the port, which travels up the catheter to irrigate the tubing and the bladder. 3. Which of the following is a negative outcome associated with impaired mobility? A. Increased amounts of calcium are absorbed from circulation. B. A drop in blood pressure occurs when rising from a sitting to a standing position. C. The amount of mucus in the bronchi and lungs decreases. D. The vessel walls of the circulatory system thicken. Correct answer: B. A drop in blood pressure occurs when rising from a sitting to a standing position. A client with impaired mobility may develop many changes in body systems that put him at risk of further illness or injury. Orthostatic hypotension occurs when blood pressure drops more than 25 mm of mercury systolic or 10 mm of mercury diastolic upon rising from a sitting or lying position to standing. Orthostatic hypotension may develop in the client with impaired mobility when blood circulates more slowly or pools in the distal extremities. 4. Which of the following statements best describes foot drop? A. The foot is permanently fixed in the dorsiflexion position. B. The foot is permanently fixed in the plantar flexion position. C. The toes of the foot are permanently fanned. D. The heel of the foot is permanently rotated outward. Correct answer: B. The foot is permanently fixed in the plantar flexion position. Foot drop results in the foot becoming permanently fixed in a plantar flexion position. This position points the toes downward. The client may be unable to put weight on the foot, making ambulation difficult. Foot drop can be caused by immobility or chronic illnesses that cause muscle changes, such as multiple sclerosis or Parkinson's disease. 5. A client is complaining of pain that starts in the shoulder and travels down the length of his arm. This type of pain is referred to as A. Referred pain. B. Superficial pain. C. Radiating pain. D. Precipitating pain. Correct answer: C. Radiating pain. Radiating pain is that type of pain that starts in one part of the body and travels to other related areas. Examples of radiating pain include pain that travels along an extremity or pain that moves from the front of the body toward the back. Radiating pain may be constant or it may come and go. 6. You have taken the vital signs for your patient. They are normal for the patient. What should you do next? A. Report the vital signs to the doctor. B. Write the vital signs on a scrap paper. C. Call the family members. D. Document them on the graphic VS form. Correct answer, D. Document them on the graphic VS form. Vital signs for a patient are documented on a graphic VS form, not a scrap of paper. The vital signs are normal for your patient, so you do not have to report these VS to the doctor. Simply document them. 7. A procedure that examines a portion of the large intestine with an endoscope is called A. Colposcopy. B. Sigmoidoscopy. C. Upper GI. D. Cardiac catheterization. Correct answer, B. Sigmoidoscopy. The sigmoid colon is located in the descending colon. A special scope is inserted into the rectum and takes video and still images of the lining of the large intestine. An upper GI is used to take still photos and video of the esophagus and stomach. A KUB is a radiography procedure looking specifically at the kidneys, ureters, and bladder. A cardiac catheterization is a procedure where a thin instrument is placed through the femoral artery and threaded up the vasculature to the heart, where procedures can then be performed. 8. In the term hemoglobin, the suffix globin means A. Protein. B. Iron. C. Metal. D. Blood. Correct answer, A. Protein. The word part, globin, means protein. Hemoglobin is a medical term meaning blood protein. 9. A patient suffering from hyperglycemia would be experiencing A. Low blood sugar. B. High blood sugar. C. Normal blood sugar. D. None of the above. Correct answer, B. High blood sugar. Patients with hyperglycemia have a high concentration of glucose in the bloodstream. Most likely the patient will also be diagnosed with diabetes, commonly referred to in layman's terms as the sugar. 10. Intermittent fevers are A. Fevers which come and go. B. Fevers which rise and fall but are always considered above the patient's average temperature. C. Fevers which fluctuate more than 3 degrees never return to normal. D. None of the above. Correct answer, A. Fevers which come and go. Intermittent fevers are fevers that come and go. They alternate between periods of being febrile and afebrile. Continuous fevers rise and fall slightly over a period of 24 hours. Remittent fevers fluctuate considerably, more than 3 degrees, and do not return to normal body temperature. 11. A patient's body temperature has varied over the last 24 hours from 97.6 degrees Fahrenheit in the morning to 99 degrees Fahrenheit in the evening. The patient is worried that this change in temperature may indicate the beginning of a fever. Which of the following best explains this phenomenon? A. The patient definitely has a fever in the evening and should be seen by a doctor. B. The patient is experiencing changes related to a diurnal rhythm. C. The patient is more than likely taking her temperature incorrectly. D. The patient is male and is experiencing changes related to fluctuating monthly hormones. Correct answer, B. The patient is experiencing changes related to a diurnal rhythm. Diurnal rhythm is the phenomenon of body temperature fluctuating depending on the time of day. Temperatures taken in the morning are typically lower than those taken throughout the rest of the day. 12. The most accurate reading for a temperature is done A. Orally. B. Orally through a clean canal. C. Rectally. D. Axially. Correct answer, B. Orally through a clean canal. Oral readings are done in the ear. The tympanic membrane shares a blood supply with the hypothalamus, which is an area of the brain that controls body temperature. Provided the ear canal is clean and free from debris, the tympanic temperature is the most accurate. 13. A patient is in the office for a cyst removal and is very anxious about the procedure. Which of the following descriptions of his respirations would be expected? A. Bradypnea. B. Orthopnea. C. Tachypnea. D. Dyspnea. Correct answer, C. Tachypnea. Tachypnea is defined as a respiration rate that is rapid, quick, and shallow. Patients experiencing anxiety over a procedure may be hyperventilating, which occurs frequently with tachypnea. 14. Rales and rhonchi are frequently noted during an examination of lung sounds. What is the difference between the two? A. Rales are louder. B. Rhonchi are noted only in infants. C. Rales occur on inspiration, rhonchi on expiration. D. Rales are noted only in infants. Correct answer, C. Rales occur on inspiration, rhonchi on expiration. Rales are often heard while a patient is taking in a breath, while rhonchi are heard when a breath being exhaled is obstructed by thick secretions in the respiratory tract. 15. To accurately assess a patient's respiration rate, which of the following methods would be best? A. Tell the patient, please remain silent while I count your number of breaths. B. Count respirations at the same time you are counting the pulse rate. C. Count the pulse rate for 1 minute, then, while keeping your index fingers on the patient's radial artery, count the respirations for an additional minute. D. Count the patient's respiration rate, then take the patient's temperature, and then take the pulse rate. Correct answer, C. Count the pulse rate for 1 minute, then, while keeping your index fingers on the patient's radial artery, count the respirations for an additional minute. The most accurate assessment of a patient's respiration rate is to count the breaths while the patient is unaware that you are doing so. Patients who are aware that their respirations are being counted may breathe abnormally. 16. A patient is diagnosed with essential hypertension. Which of the following blood pressures would you expect to see in this patient prior to taking medications for his condition? A. 142/92. B. 118/72. C. 120/80. D. 138/88. Correct answer, A. 142/92. Essential hypertension occurs when the blood pressure reading has a systolic pressure reading of equal to or greater than 140 and/or a diastolic reading equal to or greater than 90. 17. Which of the following is an anthropomorphic measurement? A. Blood pressure. B. Temperature. C. Pulse rate. D. Weight. Correct answer, D. Weight. Anthropomorphic measurements are measurements of body size, weight, and proportion. 18. The procedure for taking a pulse rate on an infant differs from an adult how? A. Pulse rates are not taken on infants. B. The apical pulse method is used on infants. C. Pulse rates on infants are taken with a sphygmomanometer. D. Pulse rates on infants are taken apically in the third intercostal space. Correct answer, B. The apical pulse method is used on infants. The apical pulse method is used in infants by placing a stethoscope in the fifth intercostal space, mid-clavicular line, and counting the beats for a full minute. This method can also be used on adults if the radial pulse method is difficult to perform. 19. A physician may assess turgor when A. Iron deficiency is suspected. B. Heart and lung issues are suspected. C. Dehydration is suspected. D. None of the above. Correct answer, C. Dehydration is suspected. Skin turgor is assessed when dehydration is expected. The skin is slightly pinched and the amount of time that the skin takes to reassume the normal position is related to a patient's level of hydration. The longer the skin stays folded in the pinched position, the better the chance the patient is dehydrated. 20. When performing an EKG, the patient starts to laugh out of feelings of anxiety. What would you expect the EKG to show? Choose the best answer. A. Increased pulse rate, normal EKG. B. Decreased pulse rate, abnormal EKG. C. Tachycardia, poor EKG graph. D. Bradycardia, poor EKG graph. Correct answer, C. Tachycardia, poor EKG graph. Patients who are unable to lie still on the exam table while having an EKG will have poor readouts on the EKG. Electrical signals given off by large moving muscles will inhibit the collection of data from the chest leads. Patients who are very anxious will usually display a rapid heartbeat. 21. When printing out an EKG, a nurse notices that the QRS complexes are extremely small. What should be the next step? A. Alert the physician immediately, as this is a sign of impending cardiac arrest. B. Check to see that all leads are attached and rerun the EKG. C. Increase the sensitivity control to 20 mm deflection. D. Decrease the run speed to 50. Correct answer, C. Increase the sensitivity control to 20 mm deflection. Increasing the sensitivity control to 20 mm will double the sensitivity, which will allow for better observation of the small QRS complexes. 22. Each small square on the EKG paper is A. 4 seconds long and 5 mm tall. B. 2 seconds long and 5 mm tall. C. 4 seconds long and 20 mm tall. D. 4 seconds long and 1 mm tall. Correct answer, D. 4 seconds long and 1 mm tall. Each small square of the EKG paper represents 0.04 seconds long and 1 mm tall. One large square will be 5 small squares long and 5 small squares tall, equating to 0.2 seconds long and 5 mm tall, 0.5 mV. 23. A patient's urine specimen tested positive for bilirubin. Which of the following is most true? A. The patient should be evaluated for kidney disease. B. The specimen was probably left at room temperature for more than 2 hours. C. The specimen is positive for bacteria. D. The specimen should be stored in an area protected from light. Correct answer, D. The specimen should be stored in an area protected from light. Bilirubin is easily broken down by light, so all samples testing positive for bilirubin should be protected from light exposure. Any urine samples that are brown in color should be suspect for the presence of bilirubin. 24. Which vacutainer tubes should be used when a requisition calls for blood to be drawn for an HNH and glucose test? A. 1 light blue, 1 red. B. 2 lavenders. C. 1 lavender, 1 gray. D. 1 green, 1 red. Correct answer, C. 1 lavender, 1 gray. An HNH stands for hemoglobin and hematocrit, which are tests that are found in a complete blood count. These tests are drawn in a lavender tube. Blood for glucose testing is drawn into gray tubes. 25. Specific gravity in urinalysis. A. Compares the concentration of urine to that of distilled water. B. Is useless when the patient is dehydrated. C. Can only be done with a refractometer. D. None of the above. Correct answer, A. Compares the concentration of urine to that of distilled water. Specific gravity measures the concentration of solutes in a liquid compared to the concentration of distilled water. Normal specific gravity readings of human urine range from 1.005 to 1.030. 26. When placing a patient in the AP position for an X-ray, what position would the patient be in? A. Facing the film. B. Right side against the film. C. Left side against the film. D. Facing away from the film. Correct answer, D. Facing away from the film. The AP position is the anteroposterior projection. Patients in the AP position are facing away from the X-ray film. 27. A patient's urine tests positive for glucose. The doctor asks you to confirm this finding. Which of the following would best confirm this finding? A. Run the urine on the handheld glucometer. B. Have another MA do a repeat dipstick. C. Run a CLINI test. D. Run an ACE test. Correct answer, C. Run a CLINI test. CLINI test tablets are used to detect glucosuria. This test is useful when urines are discolored and proper color assessment cannot be done. 28. Manual hematocrits are done. A. To monitor anemia. B. By using a microcrit tube. C. To measure the percentage of plasma to cells. D. All of the above. Correct answer, D. All of the above. Manual hematocrits are a CLIA waived method for monitoring anemia. Blood is collected in a microcrit tube, centrifuged, and the percentage of plasma to cells is measured. 29. A patient has come to the office for a blood draw. The patient starts to sweat and is very anxious. Which of the following would be the best way to proceed? A. Do not perform the procedure. Notify the physician of the reason why. B. Perform the procedure but pay close attention for signs of potential syncope. C. Allow the patient to reschedule for a time where he isn't as anxious. D. Have the physician draw the blood. Correct answer, B. Perform the procedure but pay close attention for signs of potential syncope. Sweating is a common occurrence with anxiety. Provided the patient is not showing signs of fainting, the phlebotomy procedure can be performed. Notify the physician if the patient does faint. 30. Which of the following tests would most likely be performed on a patient that is being monitored for coagulation therapy? A. Point/INR. B. CBC. C. HCT. D. WBC. Correct answer, A. PT/INR. Prothrombin times, PT/INR, are frequently used to monitor Coumadin, warfarin, therapy. This medication is an anticoagulant which slows the blood's ability to clot. 31. Which of the following is most true about the ESR test? A. The results are diagnostic for certain conditions. B. Abnormal results are indicative of a potentially fatal illness. C. Abnormal results should be followed with additional testing. D. Results are reported in millimeters per minute. Correct answer, C. Abnormal results should be followed with additional testing. The erythrocyte sedimentation rate is a screening test for inflammation. The test is not used to diagnose any condition and abnormal results should be investigated further. Results are reported in millimeters per hour. 32. Which of the following is considered an abnormal lab result? A. WBC 10,000/mm cubed. B. HCT 50%. C. ESR 22 mm per hour. D. All of the above are normal. Correct answer, C. ESR 22 mm per hour. Normal values for ESR are 0 to 10 mm/HR for men and 0 to 20 mm/HR for women. 33. The mordant in the Gram stain procedure is A. The crystal violet. B. The methyl alcohol. C. Iodine. D. Safranine. Correct answer, C. Iodine. The Gram stain procedure uses 4 chemicals: crystal violet, primary stain, grams iodine, mordant, methyl alcohol, decolorizer, and safranine, counterstain. 34. A urine pregnancy test. A. May be negative even if a blood pregnancy test is positive. B. Is positive only during the first trimester of pregnancy. C. Will be negative if the amount of LH isn't enough to meet or exceed the sensitivity of the testing device. D. All of the above. Correct answer, it may be negative even if a blood pregnancy test is positive. Urine pregnancy tests detect HCG in a pregnant woman's urine. Blood levels of HCG are usually higher and register earlier than HCG levels in the urine. 35. Mr. K is admitted to the orthopedic unit one morning in preparation for a total knee replacement to start in 2 hours. Which of the following is a priority topic to instruct this client on admission? A. The approximate length of the surgery. B. The type of anticoagulants that will be prescribed. C. The time of the next meal of solid food. D. The length of time until the client can return to work. Correct answer, A. The approximate length of the surgery. While follow-up care and discharge instructions are important to review throughout hospitalization, pre-surgical teaching should focus on what to expect for the upcoming procedure. The client may be more focused on the surgery and may want to know facts about the procedure to better prepare him or to relieve anxiety. Information about what to expect after the procedure can be presented well before the procedure and then reviewed again afterward. 36. A nurse in the emergency room enters a client's care area to start in 4. She finds a man sitting on the table, hunched over, and attempting to take deep breaths. He states, "My chest hurts so much." His wife is sitting on a chair in the corner, crying. Which of the following is the first action of the nurse? A. Bring the 4 kit and quickly start in 4. B. Assess his breathing and provide oxygen, if necessary. C. Administer medication to control chest pain. D. Talk with his wife and find out why she is crying. Correct answer, B. Assess his breathing and provide oxygen, if necessary. In the above scenario, the first action of the nurse is to assess the client's airway and breathing and administer oxygen if necessary. The client may be suffering from chest pain that causes breathing difficulties, but air exchange is essential to address before treating other needs. 37. A nurse is providing discharge instructions for a client who had back surgery. All of the following exhibit that the client is ready for discharge except A. The client still has sutures at the incision site. B. The client is able to take a shower. C. The client must still use an ice pack at the wound site. D. The client has a temperature of 100.8 F. Correct answer, D. The client has a temperature of 100.8 F. While providing discharge teaching for a client who is ready to go home, the nurse must assess that there are no signs or symptoms of emerging illness or failure to heal adequately before sending the client home. A nurse dismissing a client with a post-operative temperature of 100.8 degrees Fahrenheit should contact the physician to ensure the client is not developing an infection. 38. A patient is having a colposcopy procedure performed. How should the patient be instructed to prepare for the procedure? A. NPO for 8 to 12 hours before the procedure. B. D/C all HTNRX for 2 days prior to the procedure. C. Take 3 Dulcolax tablets and 2 containers of Miralax the day before to clear out the lower GI system. D. None of the above prep is necessary for this type of procedure. Correct answer, D. None of the above prep is necessary for this type of procedure. A colposcopy procedure is done to view the vagina and cervix. The only preparation that is necessary is to wash the external genitals with soap and water the morning before the procedure. 39. Which of the following conditions may cause an increased respiratory rate? A. Stooped posture. B. Narcotic analgesics. C. Injury to the brain stem. D. Anemia. Correct answer, D. Anemia. A client who has anemia has decreased levels of hemoglobin in the red blood cells. Because hemoglobin is responsible for carrying oxygen molecules to the body's tissues, the client may need to breathe faster to bring in more oxygen to make up for this deficit. 40. A nurse is attempting to check a blood pressure on a client when she realizes that the cuff is too wide for the size of his arm. What type of reading might this blood pressure cuff produce? A. A normal result. B. An abnormally low reading. C. An abnormally high reading. D. A low reading, followed by a normal reading. Correct answer, B. An abnormally low reading. A blood pressure cuff that is too large for the size of a client's arm may produce an abnormally low blood pressure result. The cuff should be placed to appropriately fit the size of the client's arm. If a nurse gets an abnormally low blood pressure reading in a client who is not symptomatic, she should check the size of the cuff. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.